Uro-Tainer is easy to use and can be administered by a nurse, a family member, or the patient if properly trained. Prepare the patient's bed by putting a towel on it so to absorb eventual droplets. Disinfect hands before putting on gloves. The Uro-Tainer sachet is supplied sterile and should not be removed from its plastic wrapping until ready to use. The solution should be at body temperature, approximately 37 degrees. To warm the solution, immerse the sachet into lukewarm water. Peel open the plastic overwrap and remove the Uro-Tainer. Close the clamp by pushing and clipping it together. This will prevent any leakage. Next, pull the green tag and remove it completely from the cap. Twist and withdraw the cap without touching the clear sterile connector. Insert the Uro-Tainer sterile connector into the catheter. Turning slightly will help insert the connector. Open the clamp by pushing up on the clip. Allow fluid to drain in using gravity until no more fluid flows in. Do not squeeze the sachet. Hold the bag downwards to allow the used solution to drain back into the Uro-Tainer sachet. When the bag is full, close the clamp and remove the bag from the catheter. Attach the drainage bag. Discard the Uro-Tainer properly after use. Always remember hand hygiene.